This week on Healthy Living, we look at how health specialists in the African diaspora contribute to help improve Africa's health system. And a state-of-the-art medical facility opens in Ghana to deliver special surgeries. Plus, Tanzanian American Radiologist Dr. Minja discusses efforts to improve the skills of radiologists in East Africa. Finally, how do you stop your scalp from itching when wearing braids? That's in this edition of Healthy Living. Hello, I'm Linor Moudou. Welcome to Healthy Living. Get this. Africa bears more than 24% of the global burden of disease, but has access to only 3% of health workers. According to the State of Universal Health Coverage in Africa 2021, less than half of the African population has access to the health care it needs. Observers say the contributions of the African diaspora, including those in the medical field, are playing a vital role in improving healthcare access and quality on the continent. Many patients travel abroad to seek advanced medical care. A new special surgery institute has opened in Ghana to address this need. The state-of-the-art institute will draw from world-renowned medical professionals to help deliver special surgeries and train local doctors. It is an initiative by a U.S.-based Ghanaian surgeon. Sinanu Todd reports from Accra, Ghana.
In a theater in Accra, medical experts from the U.S. perform a special cancer removal surgery for a kidney patient. The procedure is a minimally invasive surgery that uses cameras and robots. They say it is the very first time it is being done in Ghana. It is called laparoscopy.
That one couldn't have been done here. They already referred the guy outside. So he already had his visa and everything. And then someone told him about this place.
This place is the West African Institute for Special Surgery, or WISE. It opened in Accra in March to cater to specialty surgery needs in West Africa and beyond.
We provide the highest level of specialty surgery. So if you pick in a specialty, plastic surgery for example, there is just general plastic surgery trying to get wounds and broken bones to heal. But at the level that we are providing care, we do micro transplant of tissues. You lose a finger, we put it back, make an ear, make a nose, make a face.
Dr. Kofi Boahene, a native of Ghana, is a head and neck surgeon, facial plastic and reconstructive surgeon at Johns Hopkins Hospital in the US. Since 2004, he has been running outreaches across the world to help patients who cannot afford quality healthcare in their countries. The program is known as the Foundation for Specialty Surgery, or FSS. Dr. Boahene, on one of such outreach missions in Ghana, was faced with a case of a brain tumor, but the local facilities were not well equipped to handle it.
I do those surgeries in the US. It takes me 2 hours to do it and the person is cured. That child was presented to me, died. I actually tried to get her to the US so I could do the surgery. She couldn't get a visa to leave. She died.
According to Ghana's Center for Democratic Development, West African countries spend over $1 billion annually on health tourism for specialized medical treatments. Usually, it is senior government officials or wealthy individuals who can afford to travel abroad for treatment. For those who cannot, Dr. Boahene says they are at the mercy of ill-equipped local health facilities.
People from all over the world will come and see me in the US. I'm able to 2 hours change their lives. I take a plane, it takes 9 hours, 10 hours to fly to Ghana. Same situation, clinical situation, that person may lose their eyesight or may lose their life. That doesn't sit well with me.
For this reason, Dr. Boahene and the FSS moved to build the West African Institute for Special Surgery. The center will draw from globally trained health professionals to cure patients in Ghana.
In neurosurgery, in plastic surgery, in head and neck surgery, in ear surgery, in urology, the highest level of specialists are all congregating here.
Medical professionals from Ghana and across Africa can train and practice with these global experts and equipment.
Here I get to see robotic surgery. Yes, it's going to be the first in the country. So I get to see that. And that's awesome. That's pretty cool, using robots to, fix things. So yeah.
With the state-of-the-art equipment and world-renowned medical experts, Y says they hope to become the medical tourism destination in Africa and also provide free specialty healthcare services to persons who cannot afford them. Sana Anutod, VOA News, Accra, Ghana.
How would you assess the access and quality of healthcare services in your region, and what specific improvements could be made to improve the healthcare system in your community? Here are some reactions from Cameroon.
If I have to evaluate the access to these services, it is not high. It's not high because sometimes we notice that as citizens, they don't have enough money to afford some services in the hospital. And there are some people that may not understand them or may abandon them like that. Meanwhile, we have to be on their side too and understand so as to take care, ameliorate, see things that has to be changed for people to be informed. Equally, we must have agents that communicate with the citizens for them to be aware of the services, of the price that have been lowered and the price that are increasing.
There is access because you can have a hospital nearby, but to assess the quality. And the second thing is that when you enter the hospital, there are some of us who look at money. They look at you before they start talking to you. They say, no, what is the person sick or what is the person having? Before they start talking about that, they ask they should pay first before pay the consultation. You have to pay for consultation first before any person look at you.
We should respect the human being. It depends. It does not depend in levels because there's sometimes when you are coming in some hospital, they're seeing if you have money or not, and they neglect you. I want that those people should take everybody equally. And I hope that taking everybody equally will change the mind of people that are coming through them.
Professionally, as from the moment we friendly welcome our patients for the takeover till the moment of recovery, that is taking care of each patient in an individual way, make sure they are well treated, and equally the opinion of our patients after the recovery moment. What opinion do they have concerning the way we took them, and equally the personnel, that is to add the effective of the personnel.
There are some hospitals that they were built since, and it's not still functioning till now. I don't know, there's a problem here, they don't know there is maintenance. It's something I've seen that it's lacking in our country.
From medical missions to building hospitals and providing training, the collective efforts of diaspora-led initiatives remain an essential pillar in improving Africa's healthcare. Dr. Frank Minja is a diagnostic radiologist at Emory Hospital in Atlanta, Georgia, and president of road2ir.org, an organization that provides radiology training in East Africa. He discusses how medical experts in the diaspora can impact Africa's health system.
I feel that the role of the African diaspora in helping to bridge these gaps in specialty care is really to provide training, but also to be a bridge, because many of us who maintain contacts with our native countries in Africa understand the local culture, understand the local politics and dynamics. And so we are able to use that knowledge to orient our counterparts who may not necessarily be from the continent. And so we serve that cultural ambassador role. For some years now, we have been involved in actually training programs, setting up training programs, because there is a very huge lack of radiologists across the continent. Specifically, many countries in sub-Saharan Africa have one radiologist for a population of about 1 million people. That is the average number across the 54 countries in Africa. So to close that gap, we've been working very hard in East Africa to establish training programs, specifically in radiology, because you can't buy radiologists, you have to train your own radiologists. And basically, if you don't have our own training programs, that is really where the problem begins. So given our networks in the United States, we organized those teams to go on a regular basis to provide that training in Tanzania specifically. So we established a curriculum at the university in Dar es Salaam, Muhimbili University, and that works with the Muhimbili National Hospital. And so between those two, we have a curriculum and we have a good network of physicians who go on a regular basis. And up to now, we've been able to graduate 13 interventional radiology specialists who were working in Tanzania, Rwanda, and Nigeria. So in modern medicine, as a matter of fact, I would say any hospital you go to in the United States, it will be impossible for you to not be touched by radiology, whether it's an X-ray, whether there's an ultrasound, whether there's a CT scan, whether there's an MRI scan. And essentially, this is modern medical imaging. And previously, many physicians will palpate you and feel your body to kind of like, try to determine what's happening inside your body. But now with the new technologies, we're able to see inside the body and actually see and be able to diagnose. And that is really what the radiologist does. We interpret those medical images to see what's happening. And just one further point I want to make is that many governments are purchasing the machines. Right? So they're purchasing the CT scan, they're purchasing the MRI, they're purchasing the ultrasound, except they're not purchasing who's actually going to read those images when they're produced. So that's where the radiologist comes in. So it's really exciting because from a sustainability perspective, we already see that as you train our local physicians in the local environment, one, our trainers now they become their own specialists, but also our patients benefit directly from that service. So I think there's a big role for the diaspora to play. And many times, if you go to train abroad, and you come back 5 years later and you find the system is just as you left it, guess what? Now you have to like build the system from the ground.
Researchers have identified a new lineage of the Mpox virus, formerly known as monkeypox, that is linked to efficient human-to-human transmission in the Democratic Republic of the Congo. A group of Canadian and other scientists working in the country began tracking a large Mpox outbreak in the country's Kamituga mining region since October and found a new distinct clade IB lineage of the Mpox virus featuring mutations that are a hallmark of efficient transmission between humans, calling it alarming. The researchers are urging immediate action to avert another global Mpox outbreak. Meanwhile, a new study conducted in 17 sub-Saharan African countries between 2019 and 2022 found that bed nets treated with an additional insecticide are between 20% and 50% more effective in preventing malaria than those treated with the standard single pyrethroid insecticide. The Global Fund to Fight AIDS, Tuberculosis, and Malaria funded the trials as part of the New Nets project. Now, do you get your hair braided? If the answer is yes, most likely you have experienced the uncomfortable feeling of braid itch. Here is how experts say you can avoid and treat braid itch. Loosen up the braids. A common myth is the tighter the braids, the longer they will last. Always braid with the correct tension to avoid itching, headaches, and hair loss. Never leave your braids for too long because they can irritate the scalp. Give your hair a break between braiding to prevent irritation and hair thinning. Wash with caution. And finally, moisturize with hair oils. Gently massage in some coconut, castor, or jojoba oil to stimulate blood flow to the hair follicles and lift dead skin cells. That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at @LinochMudu. Until next time, stay well and strive to make every day a healthy day.